Welcome to the Trilogy Vent service. First, a disclaimer. Remember, only attempt to use this equipment on a patient if you've been formally checked off by a qualified preceptor or trainer. This video supplements, but is not a replacement for formal training. Hi, welcome back. I'm David, and I'm really excited about this new equipment, the Trilogy ventilator, and I think you'll see what I mean. Have you ever had to put a patient on a BiPAP because of respiratory distress? Sure, all of us have. Only to have that patient worsen and have to go on the ventilator right away. Of course, you had to take the BiPAP out of the room, bring in the new equipment and put the patient on that. Well, I'm happy to say that now with this equipment, you might be able to do something a little different. That's because, as you're about to see, the Trilogy ventilator is both a BiPAP and is capable of functioning the same way with a similar type of circuit, a single circuit limb, and also function as a assist control ventilator or a pressure ventilator. This is very exciting, and I'm going to show you how to do this in this presentation. I'm going to show you how to go in and set it up, how to get it started, and how to make transitions like that very easily. Here's an image showing a patient using the Trilogy on BiPAP with a traditional BiPAP mask. As you can see, he's using an integrated mask designed for this type of therapy, but if not, you will use the Whisper 2 swivel with any other type of device. For example, in this picture where we see a patient with a tracheostomy, many patients can go home like this. Okay, let's put the circuit on and get started. Be sure to grab the correct circuit for the application that you need it for. For example, right now I have the Philips Respironics disposable adult passive circuit. It looks a lot like the same kind of tubing that you'd use on BiPAP, except for it has the Whisper Swivel 2 built into the circuit. Or you might be using it on a pediatric case and use something like this, a disposable pediatric circuit. It has a water trap and, of course, spots for you to hook it up to something like a Fisher-Paykel heater. What I'm going to be using today, or demonstrating today, is the setup with an adult circuit. One thing that I'd like to point out about this is that you can also use a circuit with an exhalation valve built in line, much like you would see on an IPPB circuit. That is a different type of circuit, and in the setup on the machine, when you go in, you can tell it what kind of circuit you're using. Right now I'm using what's called the passive circuit. It does not have the exhalation valve built in, because this is the easiest way to use it, and you can still use this type of setup with a volume controlled ventilation. Now, you see the Whisper 2, one end is connected to the machine, the other end I have the Whisper 2 swivel, and for my adult patient, say for example if I were going to hook a tracheostomy to it, I could put this device on. Accordion type piece that makes the transition from the 22mm circuit side to the patient's airway side, and I have the ballard on here. I'm going to take this off, and in the place of this I'm going to put my test lung so we can see it operate. Before I move on with that, I want to quickly show you an example of the active circuit. I had the passive circuit. This happens to be a pediatric active circuit. It has the exhalation valve on it. For those applications where you're in a volume or pressure control ventilation and the machine is not managing the leak very well so that you're getting an accurate reading, you could make the transition over to this active circuit. And of course it has the line that you can hook up to a spot on the ventilator to work the exhalation valve. And then finally there's one more modification that can be added to that, and that is a flow sensor that can be put in line. And that would be put right here, and then this end connected to the adapter, which then connects to the patient's airway. With all these different modifications, I can see that I'm probably going to need to make video for each specific application, such as a pediatric case with an active circuit versus a pediatric case with a passive circuit. Well, let's turn it on and get started with our adult circuit with the Whisper 2 swivel. Okay, the first step in getting started is to get into the secret clinical setup menu, and you do that by hitting this alarm silence button and the down arrow. Push them together and you get into the setup menu. From that menu, you can see that we have some soft keys on the bottom here, and I'm going to hit Select under Settings and Alarms. I could scroll down and go to different items on this menu, but I want to start out here, so let me hit Select. Okay, now we see several options. One is dual prescription. This might be somebody who uses CPAP during the day and back on the ventilator at night. For most applications, we can leave the dual prescription off. Now, here's that circuit type that I told you about. And you notice I have it on passive, which is the right one. But let's see if we wanted to change it. We could hit modify and then scroll through the different types. And here's the types: the passive with the Whisper 2 swivel, the active circuit that has the exhalation valve built in, much like the IPPB circuit does, and then finally the active flow circuit, which is a combination of that circuit, the one with the exhalation valve, and the flow sensor in line. But for this application, let's stick with passive. Let's pretend that we have a patient we want to put in BiPAP. So I'm going to scroll down to, let's say 10, okay, and come down to EPAP, and let's say we want 10 over 5. There we go. You notice 4 was the lowest you could go. Okay. Breath rate, this would be a backup rate. Breath rate, just in case the patient were to stop breathing. I might want to modify that down. We do put BiPAP or spontaneous breathing modes on spontaneous breathing patients, so the rate just becomes a backup then. In some cases, you might dial in a rate. The next setting on our menu is inspiratory time. Inspiratory time only is active on a breath delivered by the machine. For example, I have it on 16 now, so if I kept it there, it would breathe pretty frequently for the patient. It would use this inspiratory time. When the patient takes a spontaneous breath and spontaneous timed, the machine becomes flow cycled and the inspiratory time is not active. Okay, so let's say you are ventilating your patient with a rate in this mode. What would you set your inspiratory time on? Well, I would recommend probably somewhere around 0.6 to 0.8, because if you look at it this way, 700 cc tidal volume delivered at 60 liters a minute would be about a 0.7 second inspiratory time. But again, you only need to worry about inspiratory time in terms of breaths delivered by the machine. If the patient's strictly breathing spontaneously, then that inspiratory time doesn't matter. For the trigger type, you have two choices here. You have your auto track, or you can set your flow trigger, and then you can set your flow trigger sensitivity. Probably best to just go ahead and use the auto track. Okay. We also have rise time. I think 2 is a good starting place for rise time, probably 2 or 3. Just realize that the higher the number goes, the slower and the more gradual the rise is. The lower the number is, such as 1 or 2, the more straight up the breath is delivered, closer to a square wave. Okay. Ramp length, you're probably not going to use. This is what a patient might use at home who wants to get used to a low setting to start out with and ease up to their higher level of CPAP setting. So you're probably not going to use that at all. Circuit disconnect is in seconds. You can set that as an alarm. You can also set your apnea setting as an alarm. Your apnea rate, if it is to go active. In the hospital, we probably are going to set these things: circuit disconnect, apnea, apnea rate, low tidal volume, perhaps a high tidal volume, low minute volume, and so on. And once you've got these set now, you can come back and you can turn off your machine and answer yes. And when we're ready to use the machine, turn it on. Any messages will be seen there, like in this case we need to attach the battery. Alright, now you can start ventilating. If I want to change some settings, I can hit the up arrow and my menu will appear, much like the menu you saw before. Turn my alarm off. I'm in apnea because I have the spontaneous breathing mode on. The patient's not breathing. But anyway, if I want to change my settings, I can hit select, and then I can come down here and change my settings. Okay, easy enough. Now let's say that we're going to upgrade the patient now. Perhaps the patient has been on a mask. breathing in traditional BiPAP mode, and now we want to upgrade the patient to the ventilator with a volume activated mode, but we don't want to change our circuit. We just want to use the equipment we have. Patient's been intubated. Let's do that. We can do this by going up to our mode and hitting modify. Now we can change our mode. We could go to something like assist control. Okay, you notice now we can set our tidal volume, modify. Let's say I want 700. Bring it down to 700. Let's hit OK. We can also look at our delivery rate, modify. And each one of these I can just go in, hit the information that I want. Inspiratory time, again, an inspiratory time is going to be dictated on how quickly you want to deliver the flow. If I wanted 60 liters a minute, that would be an inspiratory time of modify. Let's go to 0.7. Okay. A little flow rate chart, we can put that on the RT connection so that you'll have a reference point for things like this. PEEP, again, I can set my PEEP, whether I want to, now I'm in a flow trigger. Let's see what my choices are here. Again, I can use the auto track, or I can use a flow trigger and set that. Alright, SI, circuit disconnect, and all my alarms, and so on. Activate assist control mode. Hit this button, yes. Okay, now you can see here I'm in assist control mode, rate of 12, 60 liters a minute. You know, if I think it's too fast, I can go down and I can lengthen my inspiratory time. But if I feel like I'm not achieving my volume, and you can see that right here, I have it set on 700. It looks like I'm getting back about 540. We'll give the ventilator a minute and see if it can catch up. Yeah, it looks like it's trying to auto track, auto adjust itself to deliver the 700 relative the amount of leak that it has. If I feel like it's not accurate enough, it's not able to achieve that, then I can always change over to the active circuit with the exhalation valve. You'll notice that we didn't set the FiO2, and that's because there's a bleed-in nipple on the back here in order to bleed in and titrate that to the patient's O2 saturation. And finally, I just wanted to point out that this ventilator is for patients that are 5 kilograms or greater in weight. That's it.